you ever wondered why cancer makes people feel so sick and how it causes other symptoms like pain and a loss of appetite? In this video, I will discuss some of the reasons that cancer can cause so many symptoms. My name is Dr. David Stewart. I'm a medical oncologist in Ottawa, Canada, and a professor of medicine at the University of Ottawa. And I recently wrote a book on cancer called A Short Primer, Why Cancer Still Sucks. This book is intended for patients and is available through Amazon Books. This is the third out of a series of 16 videos that I'm putting together to answer some of the questions that people often ask me about cancer. Importantly, for your own health needs, you should talk to your own healthcare provider. Many, but not all cancer patients will have loss of appetite or nausea as a result of the cancer. But some patients can lose weight even if their appetite is very, very good. Patients with cancer can lose weight even if they're eating lots because the cancer is using very inefficient processes to convert glucose into energy. So cells convert glucose into a substance called ATP, and the production of ATP is like charging a battery. The ATP is then used to drive other cellular processes that require energy. Ordinarily, to produce ATP from glucose, the body uses a process called oxidative phosphorylation. And in this process, one molecule of glucose is converted to between 30 and 38 ATP molecules. This is a relatively slow, time-consuming process. And the process of oxidative phosphorylation to convert glucose to ATP requires the presence of oxygen. And in the process of oxidative phosphorylation, a major byproduct produced is carbon dioxide. If there is insufficient oxygen for oxidative phosphorylation, then the cell can then convert to another process called anaerobic glycolysis to produce ATPs from glucose. However, anaerobic glycolysis is very inefficient. Only two ATP molecules are produced for every molecule of glucose that's broken down. But they can be produced much faster than they could be produced through oxidative phosphorylation, and they do not require oxygen. So the process of anaerobic glycolysis leads to very rapid but inefficient production of ATP and does not require oxygen. The other thing, instead of producing carbon dioxide, it produces lactic acid. Typically, when you are running, your leg muscles are using anaerobic glycolysis for energy because they need the energy very, very rapidly, and there may not be enough oxygen. So the muscles use anaerobic glycolysis to get ATP, and in the process, lactic acid is produced. Instead of using oxidative phosphorylation or anaerobic glycolysis, cancer cells will typically use another process called aerobic glycolysis. So that's glycolysis being done despite the presence of oxygen. And it's the other name for it is called the Warburg effect, after the scientist who first discovered the process. Like anaerobic glycolysis, aerobic glycolysis only produces 2 ATP molecules for every molecule of glucose that's broken down, and it produces lactic acid rather than producing carbon dioxide. The use of aerobic glycolysis gives the cancer cell an advantage over the surrounding normal cells because it can produce energy much faster, so it can actually crowd out normal cells because they can grow faster than normal cells. In addition, the lactic acid that's produced can poison immune cells that are coming in to fight the cancer. But the process of aerobic glycolysis, again, is very inefficient, so the cancer uses up more energy than normal cells would. And it's been estimated that a cancer may burn up to 1,400 calories per day. As a result, a patient with cancer may lose weight even if they are eating very well. Also, the aerobic glycolysis is also the reason that a cancer lights up on a PET scan, because a PET scan is radioactive sugar or glucose that's injected into the body, and cancers are very efficient at taking up that radioactive sugar. The other processes that lead to weight loss are loss of appetite and a process called cachexia. These are due to immune cells that penetrate into the cancer, and as the immune cells penetrate in, they produce substances called cytokines, and it's these cytokines that drive appetite loss and cachexia. So the cytokines produced by immune cells, they're part of the reason that if you get an infection like a cold, you may not feel well, and it's because the immune cells producing cytokines that then make you feel not very well. So the cytokines that are most important in cancer are ones called tumor necrosis factor alpha, or TNF alpha, and also interleukin 6 and interleukin 10. These cytokines interact with the appetite center in the brain to reduce the appetite. They can also interact with stomach muscle. Ordinarily, when you eat, your stomach muscles are contracting to mix the food with acid and then to push the food down into the intestine. But these cytokines can interact with stomach muscle so that it does not contract efficiently. As a result, the stomach is very slow in emptying. So a cancer patient may get up in the morning, the stomach may be empty, they may eat a very good breakfast, but then when it comes to lunch, they don't feel hungry. They can't eat anything more because their stomach is still full of the food that they ate at breakfast. So patients with cancer often find that breakfast is by far the best meal of the day. And also they may find that eating 6 small meals a day works much better for them than trying to eat 3 large meals a day. The other thing that can happen is that cancer can produce serotonin, and the serotonin may lead to what's called food wastage. So somebody feels hungry and they begin to chew food, but as they chew it, they just cannot get it to go down. The other issue is that the taste buds require zinc. If there's not enough zinc, then the taste buds may not work properly, and so your food may not taste very good. And the cancer can actually take up a lot of the zinc in the body, and so there's not enough zinc for your taste buds to work properly. If the cancer is in the head and neck area, it may also interfere with chewing. Or if it's blocking the esophagus, it can interfere with swallowing. Or if it's down the abdomen, it can interfere with intestinal function. So there can be direct mechanical effects on eating as well. Okay, I said that the cytokines can also lead to something called cachexia. What cachexia is breakdown of muscle, and it's these cytokines are actually leading to the breakdown of muscle. If you were on a desert island and you had no access to food, your body would preferentially break down fat and other things like that and leave muscle. They would preserve muscle. But with cancer cachexia, that does not happen. The cytokines are actually breaking down muscle to produce glucose. And that glucose is entering the bloodstream and then can go through the bloodstream to the cancer and is actually feeding the cancer. So I mentioned that having cancer is like having an accelerator in your car that's stuck down, brakes that don't work, and the fuel tank that's always full. This cachexia mechanism is what keeps the fuel tank constantly full. So some writers have proposed that if you have cancer, you should not eat glucose because your cancer will take up the glucose. But the amount of glucose you eat has very little impact on things, because even if you're not eating anything, your cancer still has to source up to lots of glucose just through these cachexia mechanisms breaking down muscle in your body. It's this breakdown of muscle that also frequently causes patients with cancer to have tiredness or fatigue. So if we want to improve the appetite, improve weight loss, improve cachexia, the number one way to do that is to treat the cancer. So even if we cannot cure it, if we can make the cancer shrink with chemotherapy or radiotherapy or other mechanisms, other treatments like that, that can result in a greatly improved appetite, increased strength, weight gain, etc. So this is how treatments can actually improve the quality of life by shrinking the cancer and thereby reducing some of the symptoms of the cancer. Okay, cancer can also cause a lot of other symptoms. So pain is one of the most feared symptoms of cancer, but about 1/3 of patients with cancer never do have pain from it, but 2/3 do. And there are 3 main types of pain. So one kind is called somatic pain, and that's because of cancers either invading into skin or muscle or bone or the outside capsule of organs, and directly pushing on and damaging nerve fibers, causing pain, or by causing cracks in bone. That can also cause somatic pain. And with somatic pain, patients can usually tell you exactly where it is in the body. They can actually point to where it is, and if you push on the area, there's often tenderness in that area. And for somatic pain, standard pain medications will often help it. Things like ibuprofen, acetaminophen, morphine, hydromorphone. Those will help somatic pain. Corticosteroids like prednisone and dexamethasone can also help somatic pain as well, as can just treating the cancer, making the cancer shrink. That helps pain. In fact, if chemotherapy or radiotherapy shrinks the cancer just a bit, that can be a much more potent analgesic than morphine. And it's a part of the reason why in patients with incurable cancers, chemotherapy and radiotherapy are called palliative, because they palliate the symptoms or make the symptoms much better. And so it can greatly improve quality of life, even if the patient cannot be cured. A second type of pain is neuropathic pain or neuralgic pain, and it's from damage of nerves by the cancer pushing around or compressing the nerve. Standard pain medications often do not help a lot in neuropathic pain, but some other things can. So, for example, some anti-seizure medications like pregabalin can help neuropathic pain. Some people also find that marijuana or marijuana derivatives like CBD oil may help neuropathic pain. And again, treating the cancer to shrink the cancer can also be a major help in neuropathic pain. A third type of pain is visceral pain. It comes from deep in the body inside large organs. And with it, the patient is aware of discomfort or pain, but they can't actually tell you exactly where it is. It's difficult for them to describe. It arises because the large organs have very few pain fibers in them, so that the cancer can get to a very large size before it produces any symptoms at all. And typically it's only when it reaches the outside surface of the organ and starts interacting with the capsule or with surrounding bone and things like that, that the cancer really begins to cause pain. This is one of the reasons that cancers can become very large before they're discovered, just because there's no pain fibers in those organs. And I often tell my patients that we'd be much better off if cancer made people sick or caused a lot of pain when it was very small and drew attention to itself, but it just does not do that. Again, for visceral pain, standard pain medications can help. And again, treating the cancer is very important in the treatment of visceral pain, because if you can make the cancer shrink, that will help the pain. A major development over the past few decades has been the evolution of the specialty of palliative care. Palliative care physicians are pain specialists or symptom control specialists, and they are very important allies for medical oncologists and radiation oncologists. They're very important for helping to treat symptoms associated with cancer. So I've only discussed a very few of the symptoms that can be caused by cancer. There are many others as well. And for some of these, again, if you check out my book, Short Primer on Why Cancer Still Sucks, through Amazon Books. I discuss some of the other symptoms there. And most importantly, as we become more effective at controlling cancers with palliative therapies, even if we cannot cure them, then our ability to control cancer symptoms and improve quality of life increases. So I hope that you have found this video helpful and you've got a better understanding now of how cancer does cause different symptoms and some of the things that we can do to try to help. Thanks.